Hi everyone, welcome to Core of Nursing. Here I am going to talk about inflammation, and here I have covered all about inflammation. So before starting, we have to know that what is inflammation. So inflammation basically it is a mainly a reaction process. As it is a reaction, so against whom it reacts against infection, injury, or trauma. Not only that, the most important thing is by this response it protects our body, and all this process occurs locally or our body part where infection is occurred. Or here we can see the proper definition of inflammation. That is, inflammation is a localized reaction intended to neutralize, control, or eliminate the offending agent to prepare the site for repair or healing. What neutralize any toxins and control any bleeding or growth of microorganism and dead cell. Now coming to the next types. There are three types of inflammation. First one is acute inflammation, then chronic inflammation and subacute inflammation. First, acute inflammation, when inflammation occurs and persists not more than 2 weeks, is called acute inflammation. And second one is chronic inflammation, which inflammation is persist more months and it takes more time to heal. That is chronic inflammation. Then subacute inflammation. Subacute inflammation is a phase between acute and chronic. So it include element of active exudative phase of acute response and element of repairing in chronic phase also. Here are some example of acute inflammation like tonsillitis, joint pain, bowel inflammation, headache, body pain, and some example of chronic inflammation like arthritis or atherosclerosis, bowel disease, joint disease, and skin disease. Arthritis means inflammation of joint. Atherosclerosis means inflammation of arterial. Next, process of inflammation. First, vasodilation, where injury occurs, their nearest blood vessel dilate due to some chemicals and appear red in color due to increased blood flow in this area. Here, capillary widening causes increased blood flow, and as a result, feel warm or feel hot. After vasodilation, vascular permeability increase. Why increase permeability? Because of some chemical mediators like histamine and histamine secrete from granulocytes immediately after in cell injured. As vessels permeability increase, then fluid from vessels easily can pass to outside the vessels. As a result, redness occurred. Next, third stage is exudation. Exudation occurs when microorganisms are attacked by white blood cell and destroy it through phagocytosis. After that, these debris are migrate outside to the vessels and soiling occurs. Lastly, vascular stasis occurs when blood flows are slowed down and a response of stimulus as a result systemic response like fever, proliferation of WBC due to this pain occurs. Now coming to the next important point, that is inflammatory response. Within this, first happen vascular response. Vascular response occur immediately after cell injury, and after cell injury their local arterioles are constriction, and due to constriction, the release of chemical mediator due to result of chemical mediator, local vasodilations occur, and um, uh, also increase vessels permeability. As vessels permeability increase, that's why fluid movement from capillary tissue to outside. After that, edema occurred, and formation of inflammatory exudates. The next inflammatory response is cellular response. Whenever injury occurs or infection occurs, cellular response immediately activated, and leukocyte migrates to the site of injury. At first, neutrophil comes there within 6 to 12 hours, and then monocyte within 3 to 7 days, and last is lymphocyte activated after 8 days. And what are the functions of this cell? These cells are phagocytic cells, which engulf the bacteria, virus, foreign bodies, and dead cell by phagocytosis, and clean the area before healing or before cure. The next inflammatory response is exudate formation. We have just known that exudate formation is a result of inflammatory process, and it consists of fluid, leukocyte, protein, RBC that move from circulation to the site of injury. And types of exudate depends on types of severity of injury, infection, and tissue involvement. As a result of exudation, increase osmotic pressure and increase hydrostatic pressure. The osmotic pressure increased extravascularly, and hydrostatic pressure increased intravascularly. Now I am going to discuss some common types of exudate. First is serous. Serous seen in early stage of inflammation, and it results from outpouring of fluid, and some examples are skin blister and pleural effusion. And next is serosanguinous. Serosanguinous found during midpoint of healing after surgery or tissue injury. It is composed of RBC and serous fluid. That's why it is pink in color. And examples of serosanguinous is surgical drain fluid. In fibrinous, the excessive amount of fibrin that leakage from vascular wall, and it increase with increasing permeability, and most commonly seen in venous ulcer. Next is purulent or pus. It consists of WBC, microorganism dead cell, and liquefied dead cell. And example of these are furuncles, abscess, and cellulitis. Next, catarrh found in tissue where produce mucus. This mucus production increase when inflammation occurs. And next one is hemorrhage. The hemorrhage result from rupture or necrosis of blood vessels. Some examples of catarrh is runny nose, arteria, and some example of hemorrhage is hematoma or bleeding after surgery. Now we are going to talk about clinical manifestations of inflammation. First one is redness. Redness, also known as rubor, it occurs due to hyperemia or excessive blood outside the vessels. Next one is heat, or which also known as calor. Heat produced due to increased metabolism at inflammatory site. And next is pain. Pain also known as dolor, due to chemicals like histamine, prostaglandin, which stimulate the nerve pain. Also result from pressure of exudate. And next is swelling also known as tumor, as fluid shift from interstitial space to outside and fluid accumulation, and it forms tumor. Next is loss of function or functiolacia. It is due to swelling and pain, temporary loss of particular body organ. Next, management. The mnemonics used for management, that is RISE. Mm, and R stand for rest, I stand for ice, C stand for compression, and E stand for elevation. RISE is key concept of treating soft tissue injury, where R or rest helps the body to use nutrients and oxygen supply, and ice or next, management. The mnemonics used for management, that is RISE. Mm, and R stand for rest, I stand for ice, C stand for compression, and E stand for elevation. RISE is key concept of treating soft tissue injury, where R or rest helps the body to use nutrients and oxygen supply, and ice or cold compression. mm, Cold compression promotes the vasoconstriction and prevent swelling, and elevating injured extremity above the heart level to reduce edema. Then drug used for inflammation, first stage aspirin that block prostaglandin synthesis, which is responsible for inflammation. And the next is acetaminophen. Acetaminophen used as a heat regulating and NSAID or non-steroidal anti-inflammatory drugs that used as a antipyretic. And last, the drug used corticosteroid, which used as a antipyretic, prevent cytokinin and prostaglandin synthesis. These are all about inflammation. Lastly, we're going to solve some question. Question number 1: which of the following is incorrect about bedsore? First option, mobilization will affect bedsore. We all know that mobilization affect bedsore. Next, moisture will affect. Yes, moisture also affect bedsore. Next, friction force will affect bedsore. We all know that friction force will affect bedsore. With increasing friction force, there increasing bedsore. And last one is nutritional status doesn't affect bedsore. You all know that nutritional status does affect bedsore, but here mentioned the doesn't affect. So fourth one is incorrect option. Second question is thick yellow drainage from the wound is known as. We have just known that sanguinous is pink in color, and serous is clear colorless fluid. So thick yellow drainage, that on the on option, that is purulent. Then question number 3: hemorrhage with collection of blood in the soft tissue is called contusion, purpura, ecchymosis, and hematoma. We all know that here hematoma only related to hemorrhage. So the correct option is hematoma. Next, question number 4: diffuse purulent inflammation of a tissue is called abscess, cellulitis, boils, and ulcer. This question is for you students. Solve the question and write the answer in comment section, student. So thank you.